Okay, here we have our abdominal model. The two big vessels we see here are the inferior vena cava and then our abdominal aorta. Beginning with that abdominal aorta, there are three arteries that come off anteriorly, and they are the celiac trunk, the superior mesenteric artery, and the inferior mesenteric artery. Those are unpaired arteries. They come off singly and off the anterior part of the aorta. We do have some paired arteries coming from our aorta as well. They come off the lateral aspects of the aorta, and they include our renal vessels, so renal artery and renal artery, our gonadal arteries, so testicular if you're male, ovarian if you're female, and then our lumbar arteries, which would come off on both the left and on the right side as well. The aorta continues down here to the bifurcation point. We have our common iliac arteries, and then here we see that common iliac split into an external iliac artery, which will supply our lower limb, and an internal iliac artery, which will supply our pelvis. The veins here have the exact same names. So we have a common iliac vein, an external iliac vein, which fuses with an internal iliac vein to make the common iliac vein. The two common iliac veins fuse together to make our inferior vena cava. I can also see renal veins. I can see some gonadal veins as well, and some lumbar veins.